Okay, so today we're diving into healthcare, specifically those chronic conditions, like diabetes or heart disease, the ones that never really go away. Managing those can be a real struggle, right?
Absolutely. It's like having a part-time job on top of everything else.
Exactly. And that's where we keep hearing about remote patient monitoring, this RPM. It's like everyone's talking about it, but what does it actually look like in practice?
Right, and how do you even know if it's right for you?
That's what we're here to find out.
Exactly.
So today we're taking a deep dive into one company's approach, RPM Logix.
And they're really pushing this idea of being a one-stop shop for doctors who want to offer both RPM and chronic care management, or CCM.
So many acronyms, right?
Right, but we break it all down and see what it actually means for patients and doctors.
Because honestly, healthcare can feel like it's drowning in buzzwords.
It really can.
We want to know, does this stuff actually work? And what makes RPM Logix think they can stand out from all the other companies doing this?
Well, their website really emphasizes taking the burden off doctors.
Yeah.
Imagine being a physician already stretched thin with patients, paperwork, everything. RPM Logic says, hey, we'll handle the technology, the patient enrollment, even the billing. You just focus on the medicine.
So it's like outsourcing a whole part of your practice. I can see why that'd be tempting, especially for smaller clinics who don't have the resources to build their own RPM program from the ground up. But then the question becomes, how good is RPM Logix at actually delivering on those promises?
Right, and that's where we have to look beyond the marketing and see what's really going on. One thing that jumped out at me was their emphasis on having a credentialed care team. They highlight that they have nurses, dietitians, certified diabetes educators, actual people involved in these programs.
That's interesting because it goes against that image of RPM being all about cold and personal technology. It's like they're saying, we're not just strapping a Fitbit on someone and calling it a day.
Exactly, and that's a big deal because building trust and rapport is crucial in healthcare,
Yep.
especially with chronic conditions. Think about it. You're much more likely to stick with a program if you feel like you've got a real person in your corner, someone who gets your challenges and can offer support that's actually tailored to you.
Totally makes sense. Okay, so they've got the tech side, they've got the human element, but do they have the results to back it all up? Their website has this whole success stories section. We've got Wilbur, who's rediscovering clothes he hasn't worn in years thanks to his weight loss journey with RPM Logix. And then there's Margot, whose progress has her ready to do cartwheels in the doctor's office.
Those are definitely compelling stories, and I think they show the impact these programs can have on people's lives. But of course, we have to remember, these are just snapshots, carefully chosen by the company.
Exactly. They're not exactly giving us the full picture, are they? Like, we don't know how many people tried the program and didn't see those dramatic results.
Right. And we have to be careful not to fall into that trap of thinking everyone's experience will be the same.
For sure.
That's where our critical thinking comes in.
So we've got the team, the tech, some pretty inspiring stories. But what else stood out to you about how RPM Logix is approaching this whole thing?
You know what really struck me? It's how much they focus on personalization. They're not just offering like a one-size-fits-all program. They really try to tailor things to each person's needs and what they prefer.
Okay, I like that.
So they highlight this guy Benjamin in their success stories. And he wasn't just given some generic meal plan. They actually worked with him to create something that fit his lifestyle, his dietary needs.
So it's not just about lose X pounds, it's about helping people make changes they can actually keep up.
Exactly. And that personalized approach, it goes beyond just weight management too. Their diabetes care program, it also emphasizes that individualized support, helping patients really understand their condition, how to manage their meds, make good choices about their health overall.
Yeah, you can really see that theme of empowering patients, right? Like, they're not just passive recipients of care.
Right.
They talk about giving patients actionable insights and these personalized dashboards so they can track their own progress.
That's huge.
It's not just the doctor saying, do this, it's more like a partnership.
Exactly. And that's where their flexible device platform comes in.
Okay, tell me more about that.
So they're not tied to one specific device or anything. They can adjust their programs depending on what the patient needs and even what devices they already own. They mentioned working with over 550 different devices, which is pretty impressive.
That's wild. But all this tech doesn't mean much if it's not affordable, right? What's the financial side of all this look like?
Oh, you're absolutely right. Cost is a huge factor for people.
For everyone.
But here's where it gets really interesting. They really emphasize that their programs are designed to be reimbursable.
Okay, now we're talking.
Yeah, they've even got a whole section on their website about their billing optimization algorithm. Basically, they claim to have this system that makes the billing super efficient so providers can get reimbursed properly for the services they're providing.
Okay, that could be a game changer. Because if doctors can actually get paid for using these programs, it could make a huge difference in how many of them actually adopt it, right?
Absolutely.
That could mean way more people have access to this kind of personalized care.
Exactly. Reimbursement has always been a hurdle for remote monitoring and chronic care management. So if RPM Logix can actually make it financially viable for providers, it really could remove a big barrier.
Okay, so we've talked about their full service model, their focus on the human element, their adaptable tech, and this whole reimbursement angle. But before we get too carried away, let's take a step back and think about the bigger picture for a second. I don't know about you, but it feels like companies like this RPM Logix, they're like part of a much bigger shift that's happening in healthcare. Like, are we moving toward a future where more and more of our care is happening remotely?
Yeah, it's definitely a trend worth paying attention to.
Yeah.
I mean, on the one hand, you've got all these potential benefits. Like, think about it. Increased access for people in rural areas, maybe places without a lot of healthcare options. More frequent monitoring for folks with chronic conditions, which could be huge for staying on top of things. And maybe even lower costs overall if these programs can help people stay healthier and avoid those big expensive interventions.
Oh, and don't forget the convenience factor. No more fighting traffic or taking time off work just for a quick checkup appointment.
That's a good point.
That could be a game changer for a lot of people. But of course, it's not all going to be smooth sailing, right? There are some real concerns about this move towards remote care, too.
Absolutely.
Yeah.
I think one of the biggest challenges is making sure everyone can actually access the technology.
Yeah.
And that they have the digital literacy skills to participate.
Hmm.
Not everyone has reliable internet or even feels comfortable using technology, especially when it comes to their health.
It's like we're trading one set of problems for another in a way. And what about those moments when the tech just fails us? Like, what happens if someone's blood pressure monitor malfunctions or their internet goes down? We can't just rely on these things completely without having a backup plan.
You're hitting on a really important point. For remote healthcare to actually work, it has to find that balance between the high tech and the high touch.
Yeah.
Technology can be an amazing tool, but it can't replace that human connection that's so essential in healthcare.
It's that human touch, isn't it?
Yeah, and that seems to be something RPM Logix gets, at least based on what we're seeing on their website. They do emphasize the care team and that personalized support quite a bit.
True, they're trying to bridge that gap, aren't they? Combining the efficiency of technology with the empathy and guidance you get from a real person. But as we've been saying all along, it's crucial to go beyond the marketing and think critically. What could happen if we start relying too much on remote monitoring? Are there ethical questions we should be considering, especially when it comes to things like data privacy and security?
Those are questions we should all be asking. Like with any new technology, there are always unintended consequences and things we didn't see coming and ethical dilemmas to work through. It's on us to have these conversations to really weigh the potential benefits against the risks and ultimately to make sure this technology is being used in a way that benefits everyone, not just a select few.
Well said. And on that note, I think it's time to wrap up this deep dive. RPM Logix talks a lot about small wins leading to big changes, and that really stuck with me. Obviously, they're applying it to healthcare, but it's a powerful idea that goes way beyond managing a chronic illness.
It really does.
So here's something to think about as we sign off today. What's one small step you can take today? In your health, your work, your relationships even. What small action could create a ripple effect and lead to positive change in your life and the lives of those around you?
It's something to ponder.
It is. So until next time, stay curious, stay informed, and as always, keep diving deep.